Good afternoon, everyone, and thank you for joining us today for this webinar, Let's Clear the Air, everything you need to know about making the right decision for indoor air quality improvements. With me today is my colleague, Tim Campbell, who's in our Inspiration Center. I want to tell you a little bit about our lab and what we do. As you see, we are air filtration specialists. We have been providing filtered solutions for the protection of laboratories across the world for over 53 years. As you see, we have at-source containment solutions, which are fume hoods, you see directly behind Tim, which are used to formulate compounds, drugs, vaccines. So we are working with the very same companies that are helping to deliver medications and vaccines to help mitigate this unfortunate global crisis. Above Tim, you will see the Halo, which is our whole room air filtration system that we will be discussing specifically today. Tim, thank you.
Thank you, Jesse.
So today, our goal for this webinar is to educate you on the impact of poor indoor air quality, or otherwise known as IAQ, and the proper solution to improve the air you breathe. And equally as important, we want to address the technologies and products that have been promoted as miracle workers, quote unquote, to address the mitigation of viruses, all to capitalize on an unfortunate global crisis. It was never part of Lab's business plan to offer our products to the commercial sector, but because of what we were seeing, we quickly realized we needed to be the voice for all of those who were being deceived into believing they were purchasing a product that would deliver the miracle of guaranteeing virus mitigation. Throughout this presentation, we will uncover the truth behind the scams and also provide a solution that has been validated with quantifiable real-world results, knowing that what we present is a piece to the puzzle, albeit a very important piece. By addressing these serious concerns, we should always see it as a multi-pronged approach. Let's get my slides to work. So a couple of facts, and I really want to start with a did you know slide, because a lot of people don't really understand the impact that poor air quality has on our overall health. And I'll start with, did you know that we breathe, first and foremost, 8 to 10 liters of air per minute? Now that's actually magnified when we talk about children. Children actually breathe between 12 to 20 liters of air per minute because they just breathe more rapidly. With every breath we take, we breathe in 3% of someone else's air in a communal setting, which is why we've seen the spread of airborne viruses be so prevalent, especially in schools, early childhood care, and Head Start schools, because it's a communal setting and there is just a tremendous amount of bioaerosols released from each human present in those facilities. We spend 90% of our time indoor. Now, kind of understand what I just said, 90% of our time is spent indoor. And the EPA ranks indoor air quality as being among the top 5 environmental dangers, and yet we're exposed to that 90% of our time. Indoor air is between 2 to 5 times, sometimes even 100 times more polluted than outside air. And poor air quality contributes to about 6 million premature deaths per year and is the 4th leading cause of death in the world. It just isn't just third world countries. This is here in the United States, the European Union, Canada. This data is prevalent throughout the world. Why it's so important to mitigate the risks or mitigate particles or even VOCs is because the higher the particle load that's present in a room or a facility, it actually increases the infection possibilities from bioaerosols. And that's because more particles, they actually act as transporter devices. So think of a subway. You have subway trains, you can fit more people in it. They're transporting. Same with a larger particle. It can fit smaller particles inside of that larger particle and actually transport that virus throughout the facility. So it's very important to mitigate the risk as much as we can of overall airborne pollution. Now, when I talk about particle matter, they really measure it based on the diameter of size of that specific particle. So to kind of put that into context, dust and pollen and mold, that's 10 micrometers in size, whereas beach sand is about 90 micrometers, and a human hair is between 50 and 70 micrometers in size. The particles that we're very, very concerned about is what's known as PM 2.5. and that's particulate matter, 2.5 micron in size and smaller. These are very hazardous particles because they bypass the nose and throat, and therefore they penetrate deep into our lungs, bypassing our mucous membranes. And this is which point we become compromised, and we can start seeing exacerbation of chronic diseases such as asthma, heart attacks, bronchitis, and other respiratory problems. And in fact, exposure to PM 2.5 has been linked to higher COVID-19 infection and mortality rates. And this is right off of the NIH website. So we will provide you with this presentation, and you will have this data with these call out addresses so you can actually research the data yourself. But it's very important to know, and not many people understand the true impact. You know, we talk about bad air quality, the impact it has on us, but what about the impact it has on our children? Well, increased hyperactivity, difficulty in memorizing, cognitive abilities are drastically compromised. It leads to poor sleeping habits. It aggravates asthma and other respiratory illnesses. And this is a fact that kind of floored me when I read it. There's a greater risk of cardiovascular disease later in life, the more you're exposed to poor indoor air quality. So this must be addressed and can no longer be ignored. You know, we fall victim to the known, which is pollution, but the unseen, because all this pollution we're talking about today, viruses, molds, fungus, PM 2.5 are unseen. So we have to figure out a way to properly address it. But schools are even more so impacted, whether it be Head Start, Title I school, even early care centers, because typically these buildings were built 50s, 60s, and 70s, and they're prone to poor indoor air quality, mainly because of the building components they use to build the schools. You have off-gassing of formaldehydes, you have nitric oxide being released, you have other VOC emissions being released from tiles and ceiling tiles and floor tiles. We just, again, we don't know because we can't see it. Sometimes we can't even smell it, but we are exposed to this day in and day out. So it has to be addressed, and why we have been focusing on schools, again, whether it be Head Start or early childhood or even K through 12, because we know this is where the greatest challenge lies. And we know the benefits of using high efficiency air filters is significant. It's been proven and it's been validated. So this slide really hits home on why such an impact on schools. But let's try to understand how to mitigate our risk and really understand how, first of all, airborne bioaerosols are spread and viruses are spread. When COVID-19 first hit us in the face 20 months ago, it was said that formite transmission, which means transmission of touch, close proximity, was our greatest risk. Nobody talked about airborne transmission. So therefore, everything that came to our house via Amazon, or if we had our groceries delivered, wipe down the packages, wipe down the bag, and we will live in an extreme fear of everything we touched, ignoring what we breathe in. Few months came down the road and quickly, oh yes, this virus is airborne, just like influenza, just like RSV and other airborne viruses. This virus meaning SARS-CoV-2, is transmitted more so through the air than it is through any other way, touch, close proximity. And it's because when we breathe in these bioaerosols and these infectious, what is known as droplet nuclei, they are so small. Remember, PM 2.5 are those risky particles between 2.5 micrometers and smaller. You breathe them in, they bypass your mucous membrane. A virus is about 0.125 micrometer in size. So it's extremely small. And that's why lower respiratory infections have become so prevalent with COVID-19. And that's why RSV is really hitting hard. I know in October and November, I knew personally in my family, kids were infected by RSV, a lot of them, and some very seriously ended up in the hospital. So it's not just COVID-19 that we have to worry about. This is a global crisis, and this is a crisis we have been dealing with for a very, very long time, and it's now just time for us to address it. Hopefully, eyes have been opened. But I also want to touch on what is a successful equation to infection, and why is it so important to reduce concentration? Why do I speak about concentration loads? Because the successful infection equation is exposure to viral load concentration over time. So the greater the concentration, of particle loads, viruses, fungus, mold, whatever it may be, times time means our risk is greater and greater to all kinds of health issues, short and long term, and obviously transmission of diseases. So we need to figure out a way to address this and drive these pollutants up and away from the breathing zone. However, there's been very little guidance from legislation or even the CDC or ASHRAE. ASHRAE is Association for Heating and Air Conditioning, and they're meant to establish guidelines for air quality. However, there's been very little discussed about what is the right thing to do other than increasing my outside air, increasing my air change rates, adding a MERV 13 filter to my HVAC system. Those are things that we've all heard. But what does that mean? And what is the impact that that would have on your facility? How do I increase my outside air? How do I increase my air change rates with the current HVAC system I have? And let's not forget, even if I did that, how much would that impact the cost to my heating and cooling loads? We work with several schools, several Head Start programs. One school, actually a middle school and a high school here in Bedford, Massachusetts, did everything the CDC and ASHRAE recommended. They increased their outside air, they increased their air changes. However, what they saw was because of those increases, they increased their operational cost exponentially. They were spending on average between $13,000 and $15,000 a month in energy. As soon as they made these increases, after they've spent millions of dollars upgrading their HVAC system, their monthly spend went from about $15,000 a month up to $47,000 a month. What's going to happen? It's not sustainable. The school cannot afford it. So all those upgrades that they did to increase air changes, to increase outside air, upgrade the filters are for nothing because they're certainly not going to keep that going. An HVAC system's only effective as long as it's on. So if you find out I'm running this HVAC system 12 hours a day and I've increased my operational cost by 50, 60, 70%, well, guess what I'm going to do? I'm going to have to back off the amount of times I'm running this HVAC system. And now I'm only processing the air every 15 minutes as opposed to continuously throughout an 8 to 12 hour period, which means throughout the rest of the 45 minutes that an HVAC system is not on, guess what happens? Stale air. You're not processing anything. You're increasing concentration loads, therefore increasing your infection. Now, some facilities can do all this. They can upgrade it. They can increase their filters. They can increase their outside air. And it's not that big of an impact to them. Most cannot. So these guidelines are antiquated and extremely costly and really unsustainable. So what solutions can control bioaerosols effectively and sustainably? And we'll talk about that. But let's first talk about, again, one of the products that has been selling like hotcakes because it's easy off the market are floor-mounted HEPA filtered systems. You can get them on Home Depot, you can get them at Best Buy, you can get them off of Amazon. Why not? All I heard was I need to upgrade. If I can't upgrade my HVAC system, supplement it with HEPA filtration. Okay, I bought a HEPA filtered air filter, I'm good to go. Unfortunately, that's not the case because it's not just about HEPA. It's about airflow dynamics, proper dilution, and proper ventilation effectiveness in room mixing. If you don't have all three of those things, it's really an equation that needs to be done delicately. If you don't have them, then you don't have the proper solution. And these diagrams just kind of show you what happens when you have just a floor-mounted HEPA filter. We know you release particles. If you're sitting down, you're near the floor, even you're walking, they're going to remain propagated in the air for quite some time. And this shows you what happens. It releases from a sick patient in the back of the room. That air filter is right behind that sick patient. That air filter is literally blowing air upwards, and then it's taking the air across the whole classroom or facility, and then it's intended to bring that air back to the air filter. Well, what happens? It's infecting and it's allowing concentration loads to bypass the breathing zone of all other occupants. And this shows you what happens when you have a sick patient near the air filter. You're actually increasing your risk of infection. It's not a solution. They're applying technology where it does not fit. These types of air filters were meant to be installed in your residence in your bedroom, your living room, where you're going to capture the large particles that fall to the ground, cat, dog dander, fur, dust bunnies, large dust particles. It's never intended to really work against bioaerosols in a communal setting. More importantly, we have to understand the thermal load of humans. Naturally, and Tim's going to show you in a little bit what happens with thermal load, but naturally, we emit about 75 watts of energy from our body. We have a heat load. So as we release emissions from our mouths or our nose, it naturally wants to rise. It's called a thermal plume. So why would we want to take that naturally rising bioaerosol back down to the breathing zone? It's ineffective. We want to continue to drive that upwards. And that's really the safer way for ventilation, as you can see from this diagram. We want to drive the emissions, whether it's a bioaerosol from a human or just generalized bioaerosol present in the facility, drive it away from the breathing zone. So now we need to really do our homework. And why I say that is because I'm sure everybody on the call has looked into multiple technologies. You just want to do the best thing for your facility. But unfortunately, everybody you've researched, they all say the same thing. This technology is the latest and greatest. It's effective at capturing 99% of viruses. We're going to give you the miracle worker. You'll no longer be exposed to any type of infectious emissions. Unfortunately, that's not true. Secondly, we have to look at what were these companies doing before COVID? As I mentioned earlier in the presentation, a lot of these companies want to capitalize on an unfortunate global crisis. Most of them became experts within a month. We have to look at what these companies were doing before COVID, what type of technology they're trying to introduce to you. And we want to educate you again on the right thing to do for your facility so you don't make the wrong decision. So let's start talking about it. The first technology is upper room UVGI. UVGI or UV lighting has been talked about. I'm sure you've all heard it. There's all kinds of UV products on the market. Upper room UVGI's intent, its initial design was made to work in hospitals, specifically in highly contagious zones, such as tuberculosis zones. It's meant to draw UV rays across the ceiling, but you have a safe plenum that literally just makes sure the rays of that UV lighting shines across the ceiling about a foot down, and it doesn't reach the occupant zone, which means they're not exposed to high rays of UV exposure. But in order for the UV to work, nothing's going to happen if you're just shining rays at the ceiling. What is that going to do? You have to drive the bioaerosol to that UV and make sure it has total exposure time to that UV lighting to properly inactivate any present microorganisms. So you see from the diagram below, you have to have a very delicate balance of proper airflow to ensure that you're driving polluted air up away from the breathing zone again and within the UV rays for a long enough time for the total dose that's required to inactivate the microorganism. You put this in a school, it's not going to work. It's going to do nothing. It's literally a waste of money. It has to be applied in the right setting. The next technology is ionizers, or needle point bipolar ionization. These are being sold as hydroxyls, or the magic pixie dust that just emanates through the HVAC system and disperses these negatively and positively charged ions to deactivate and capture and kill any particle or any bioaerosol present in the facility. Doesn't work. This technology was intended to be used in areas of close proximity, such as an ice machine, or inside the HVAC system to deactivate anything that's going to the coils or even the filter itself in the HVAC system, but it will never address the air. If these companies were to generate the amount of ions necessary to actually disperse them properly through the HVAC run, however long that may be, down to the facility and spray these hydroxyls along the rooms, they would generate so much ozone, it would be deadly to the human body. You can't do it. Again, applying technology where it does not belong. So be very, very cautious of these technologies, even air filters that say they have ionizers in them, because some of them even today still generate ozone and other organic substances that it reacts with. They can generate VOC such as chloroform and even formaldehyde. So again, the solution cannot be worse than the problem. Ultimately, that could be the case with ions. Floor-mounted systems, we already talked about that. We don't need to beat a dead horse, but again, be very cautious. A technology that does not serve its purpose in a communal setting. Then there are floor UV units. Again, we talked about UV. This is just a very expensive fan that literally blows air around. Possibly a UV, as the air flows, it will go past UV lighting, but so what? Yeah, that air needs to bypass the UV, again, very delicately, so you have the total dose of that UV exposing that microorganism to inactivate it. You can't do that when you're blowing air at, I don't know, 300 CFM, which is cubic feet per minute. That's how much volume of air you process within these systems. And in fact, Sacramento City Unified School District purchased this specific product. I think it was $3 million worth of these systems, just to basically say, nope, we're not installing these. Step aside. We want to actually test the efficacy of the product ourselves. At the end of the day, the company's under litigation. They return to everything. There's just been so much of this going on over the last 20 months. It's subsided quite a bit because fortunately, a lot of these companies have been exposed, thank goodness, but it still exists. So again, be very, very cautious. And a couple other things, we talked about upgrading the HVAC system. I talked about MERV filters. What is a MERV filter? What does that mean when we say MERV? It's an efficiency rating that you grade the filters. So many of us at home in our heaters, we have MERV 7, MERV 8 filters. Sometimes we have a good enough HVAC system. We may even be able to introduce MERV 13 filters. And really, it's the overall efficiency of capturing viral particles or smaller particles down to 0.1 micron in size. To dive a little bit deeper with the MERV filter, again, it starts MERV 1 can go all the way up to MERV 20, which is a Hepa filter, but it just shows you this slide shows you the effectiveness between the different types of MERV filters. So really, as you see here, MERV 13 filters still really aren't great. You're looking at between a 50 and 85% efficiency, which is not good enough. And again, if a MERV 13 filter is in the HVAC system, it's only effective when the HVAC is on. So really, HEPA filter is critical because it does capture 99.97% of particles down to 0.1 micron. And if you do a lot of reading on HEPA filter, it will always talk about 0.3 micron in size. That's because that's the testing they do. They test all the efficiency of filters on microns the size of 0.3, because that ends up being the most penetrating particle size. So that's actually the particle that will break through or break through the HEPA filter first. It actually becomes more efficient to smaller the particles and obviously more efficient to larger particles. And then this last bit of two other technologies I want to talk about. Induct UVC. Again, it's not going to address the air in the room, but it will address the air going into the HVAC and for the coils and the filter within the HVAC system. But again, does not address the room, therefore does not provide room level mitigation. And same with generalized large UVC systems, which are meant to go in rooms unoccupied, which means you've had a breakout of some sort and you want to quickly deactivate any potential viruses that are present on the surfaces. These work. You roll them in, you turn the UV light on, has a dosage time between 10 and 20 minutes, and it will deactivate and decontaminate the isolated room. Again, isolated. You cannot do this in occupied scenarios. It has to be unoccupied, and it still, yet again, does not address airborne pathogens. It's just going to hit the surfaces, and only the surfaces that the UV rays shines on. Anything that's shadowed from a chair, from whatever it may be, it's not going to address that. So again, just want to educate you on all these technologies. And then last but not least, certainly, is fogging, chemical fogging. Stay away from this. These are hazardous emissions that are literally fogged in the facility. And then after the fogging is done, it leaves a very harmful residue on the surfaces for children to touch and then put in their mouth, whether it be a toy or they just rub their the desk or whatever it may be, and they put their fingers in their mouth or the toy in their mouth, they have a high risk of chemical contamination. That's why the Zonos that IHS presents is a great solution, because you put these toys, you put these bags, you put these lunch boxes inside the Zono machine, and obviously it deactivates through high energy ozone safely, and therefore you have no byproducts. Fogging is tremendously dangerous. The only time you fog, my background is environmental control. You fog in pharmaceutical facilities where it's very controlled. You actually have to tape off each room you fog in, and it's meant to, you really give it a high dose of, whether it be dry hydrogen peroxide or chlorine, bleach. You give it a high dose, you let it sit in that one room that is literally taped off. You let it degrade over time, and it's supposed to get rid of, and it does get rid of, mold and bacteria and things of that nature. It's the only time you really want to do any type of fogging, certainly not in any type of academic setting. So we've done our homework. What is the proposed solution? One thing I do want to mention is you do see the QR code. I will leave this quick 30 seconds. If you'd like to scan the QR code, open up your phone camera, take a picture of the QR code. If you want more information, it will bring you to a form to fill out, and we can deliver you more information, whether it be test data, the presentation, if you would like to set up a meeting. So please, if you want to take a moment to just scan that QR code. And then I'm going to allow Tim to get prepared for a quick demonstration to show you the Halo in action, real time, so you can understand the thermal load plume, how it works, how a room will function if it doesn't have the proper ventilation, and what happens when we add ventilation through filtration of the HEPA filter. So again, the Halo is the solution that we're proposing. We implemented across the country, across the globe, where we've done third-party testing, real-world studies, and control testing on the effectiveness of this product. Again, we're experts in air filtration, whether it be at the particulate level or the molecular level. This system was designed to be ceiling mounted. It does not integrate into the building's HVAC system. It's completely independent. Its intent to draw air up, capture it, and then disperse clean air in what's known as a Coeander airflow pattern, as you see from this diagram. And that's because if we miss anything, if anything bypasses the filter the first go around, we sweep it, we give it a clean curtain sweep, and then we drive the air back up. But it also is designed to have a delicate balance of increasing the ventilation effectiveness. And that means really proper room mixing. So we don't have a turbulent environment or dead zones. We want to make sure we treat that whole volume of air. So there's a lot of technology built into that. Each Halo consumes about 50 watts of energy. I think throughout a year, if you go on energy.gov, it equates out to be between $50 and $70 a year energy consumption. So with that, I'm going to give the show to Tim, and he will do a quick demonstration on how the Halo works. Let me just make him a priority here. All right, Tim, the show is yours.
All right, thank you, Jesse. As you can see, if you tap on, if you look at my screen, you can see the Halo is hanging from the ceiling. It is not currently on. I'm going to use a smoke machine to simulate a very large dose. You'll never have a dose release this large at one time. It's going to be small doses over time. But this will give you an idea of airflow pattern in a poorly ventilated room. This room, HVAC is not on, so you'll see the smoke just kind of sits in the middle of the room. It does rise a little because the smoke is warm. This room is cold, but you can see it just concentrates there and basically sits at the breathing zone height. I will now turn the Halo on, and then you'll see the air pattern change and see the ventilation effectiveness improve in the room. You'll start to see the lights turning on, the fan speed is starting to ramp up, and you'll start to see the smoke slowly move up towards the HEPA filter, and then the air ventilation or the air pattern, airflow pattern It's going to start moving the smoke around the room, and eventually it's all going to be removed by the halo. And now in your classrooms, you're going to have small doses released over time. So with the halo running 24/7, it's constantly going to be removing any viruses, bacteria, anything that is exhaled all over time. So you never have that buildup, never have a high concentration. As you can see, the smoke is moving around now. You can see the room air is mixing, which helps with dilution within the room until it can be pulled up into the HEPA filter and captured. Just going to give it a little more, and then I'll do another high dose, and you'll see how different it is with the halo actually on, and how that high dose doesn't just sit in the middle of the room. It is immediately pulled upwards towards the HEPA filter. Okay, I'm going to release the dose. Now you can see
That was
moving
quite a
up.
Steve, Tim.
It's moving around, so even it's getting more diluted with the air, but it is going towards the HEPA filter. Clean air is being returned in, so clean air is now mixing in with the smoke, and it continually circulates up through the HEPA filter, and more clean air is returned into the room until the room will be clear of smoke.
Perfect. Thank you, Tim. And Tim, can you explain the light and the functionality that it has as well?
Yeah, the light you can see around the top of the halo, that's just meant to let you know everything is working properly. If there were an issue, it would start to beep. You do have the ability to turn that off. You can dim the light completely. You can dim it so it's just barely on. Whatever best fits your room for nap time, you may want to turn it down. It may not bother them. The noise of the halo, white noise, I'm not sure if you can even hear it through the camera. It's actually very soothing. We've heard from Head Starts that have installed it. They like it. It's good for nap time because it's white noise. It helps the kids sleep and drown out other outside noises.
Thank you, Tim.
Thank you, Jesse.
All right. So yeah, the light around our products, you may have seen at the beginning of our presentation. There's a purpose behind that. Because we serve laboratories, and that's been our business for over 50 years, we really have to adhere to strict criteria and strict standards. And it's in the front of many different things, such as communication capabilities, detection, and overall performance criteria. And that light really provides an indication real time of how the product's performing. With the halo specifically, that light pulses. It means that the functionality of the product isn't working at peak operational performance, meaning the fan status, the fan speed may have been reduced to less RPM speed. We need to change the filters, or there's just an overall mechanical issue. That light will pulse, followed by an audible if you set it to provide you with that audible sound. But just as importantly, all of the products communicate through what's known as our eGuard platform. So it's a web-based platform where you can actually get real-time connection status of the performance of the product, and you can control all products from your cell phone device. You can turn it off, you can dim the light, you can increase the fan speed if necessary on the halo. So there's a lot of value built into the product itself. So again, thank you, Tim. Presentation working. All right. So now I want to go over the effectiveness and studies and quantitative results that we've obtained through many different tests. And we're not done. We try to provide pre and post installation validation testing on a lot of our customers if it's logistically possible for us to do so. And obviously during the times of COVID, it's a little bit more challenging. But nonetheless, we've done a lot of studies on installs that we've done. And we really want to look at the load before installation and the load after to get real third-party peer-reviewed data to our customers to know that, yeah, this product performs, not in a controlled setting. Why it was important for Tim to give you a live demonstrations, because I don't want to provide you time-lapsed demos of how the product works and you let the smoke release and wow, 2 seconds it's gone. That's not the reality. We want to give real world data and deliver that to all of our customers. But we also do have controlled testing where we have to test for the effectiveness of actual viral particles or aerosolized viruses, which is called MS2, typically a surrogate to influenza and other respiratory viruses. And then we had to study the impact of the ventilation effectiveness in room mixing. So all of that has been done, and we will present anybody with all of the test data if you so want to review it yourself. But I'll give you a quick summary of these tests. So what you see on the screen now, the test to the left was done by an HVAC consulting firm called 3Flow, where they took our halos and they installed 2 in their office, and they wanted to see what the total reduction was and get a baseline of the total particle dose, talking with the halo on, talking with the halo off. And as you see, the black graph shows you the particle load in the 10 to the 6th power, which means add 6 zeros after that number, of how many particles were in the air without the halo, and then how many particles ended up being in the air with the halo on. So again, we saw an average between a 62 and 74% reduction consistently. They also tested the halo for overall ventilation effectiveness, in which they saw a 27% increase. Again, remember, we're not touching the HVAC. This is all independent. That is an unbelievable achievement. You don't even get 27% when you upgrade the HVAC system. On average, you see it between a 5 and 10% variance. The data on the right was another controlled testing performed by ARE Labs, and this is where we tested that MS2 bacteriophage virus. And really what you're looking for in these types of tests is what the log reduction was over time. And the log reduction means what was the percentage and reduction of pathogens present in this biosafety chamber. What they were able to obtain from this testing is within 15 minutes, we achieved a log 1 reduction, which is a 90% reduction in overall pathogens. Within 45 minutes, we were at a 2.5 log reduction. So we were about 99%. Within 60 minutes, we were close to a log 4 reduction, which shows, yeah, it works. The HEPA filter is effective. Again, does not tell the whole story. It's the real world data. And this is what you see in this graph. The bottom one, after the baseline test from 3Flow, and then the other 2 to the right. These are tests performed from WSS, which is now Foot Locker. So they're huge shoe warehouses. They installed 10 halos, and they wanted to see at 180,000 cubic foot facility, by the way, massive facility. We weren't even expecting to get these reductions because they only installed 10, but they actually worked with their existing HVAC system because it's a big facility, so they were already pulling enough air. So we worked, meaning we placed the halos as close to the return vents. So as the air was already being pulled up from their existing HVAC system, the halo was working with it to capture any of the particles present in that facility. So the baseline we got before installation is the blue graph, and then the baseline after installation is the orange line. And what we saw was an average reduction of 80% between particles 0.3 up to 1 micron in size. Massive reduction. And then this test data is another real world test performed at the community chapel in Nashua, New Hampshire, and it shows the reduction, pre and post. The yellow shows you what the particle counts were before installation, and then the green after installation and the overall average. And what we saw is the total cumulative reduction was 75%. Now, this is a basement. I'll show you here, this is actually the install. So this is in the basement of the youth center. It was very critical for the Pastor Jeff DeFranco to get his kids, back in a communal atmosphere and really preach the word of God to them. No kids getting the proper education, but it was extremely important for this pastor to get them together again. But because this room was in the basement, it posed other challenges, meaning we saw particles very large particles, we saw very high spikes that we traditionally don't see because basement, not a lot of airflow. You have a lot of things going. Basements in general are dirty. They're susceptible to a lot of mold, fungus. So if you see this data here, you can see that the microns, 5 and 10 micron counts are very, very high before installation. And then after installation, we reduce them drastically. Now, one thing I do want to point out, the more particles we have on the larger side, the less reduction we'll see on the smaller side. And that's because those larger particles will actually shadow the smaller particles. And that's because the way a particle counter works, how we actually detect the particles in the air, is you have a vacuum that draws the particles in, you measure the particles per cubic meter, and then there's a light that shines to measure the particle size and diameter. So obviously, if there's more larger particles, it's going to hide those smaller particles. So it's just kind of an anomaly in this situation, but nonetheless, as you can see, we still saw massive reductions. And then this bit of data, this is actually data, this is pre-installation where we have not done the installation. This is a Head Start facility. They have one in Londonderry, one in Hooksett, New Hampshire, one in Tilton, New Hampshire. So these are the particle counts we have done before install. Install is going to be taking place in 2 weeks. And I was with the director. I was taking particle counts at all the different rooms. And immediately, the one highlighted in yellow, as soon as I took these particle readings, Danielle, the director, said, "This is my sickest room." And I said, "Here's why." Again, highest concentration of particles, sickest room, the equation adds up. Successful equation for sickness and infection is exposure to dose concentration over time. There you go, case in point. So we're actually extremely excited to be able to present the data of this facility once we have the halos installed. This facility is going to be installing, I think, 41 or 50 halos. So we're very eager to share with you the data of the reduction. The other bit of testing, this is actually puts it all into kind of context when we're talking about COVID specifically. So this testing was done by another third party in a COVID-19 patient room at a long-term care facility. And, room 118 and room 120 were the subject matters, and both rooms had positive COVID-19 patients. Room 120 had the halo, room 118 didn't. And what we wanted to test for was any possible RNA copies or N1, N2 positive proteins. Now, the patient in room 120 was at the start of quarantine. Patient in room 118 was towards the end of quarantine. If some of you know, the beginning of infection 2 days before and 2 to 5 days after infection is where we actually shed the most viruses from our bodies. And that's evident in this data. And as you see, when we took swab samples at the floor of the bed and the window shelf, room 120, we had 23,000 copies of RNA on the floor and 820 at the window shelf. Whereas patient in room 118, we saw nothing. However, where it gets extremely interesting, we obviously wanted to test the air and the return registers. Nothing was detected in room 120 because we had the halo. Again, we're capturing those bioaerosols. We're not letting them linger in the air. Whereas in room 118, 3,500 copies. It just speaks to the effectiveness of this product. And again, this was done real world data in room settings where we actually had COVID-19 patients. So in summary, the ventilation is the key to mitigating the risks associated with poor indoor quality when done the right way. It can not only improve ventilation effectiveness, but also reduce the risk of PM 2.5 and bioaerosols. And while there are many options available, some that look appealing due to cost and great marketing campaigns, we must look at all the data to determine the best solution for our facilities. So with that, I'd like to thank everyone who joined the presentation today, and we'll leave a few minutes here for some questions and answers. So I'm going to start with the first question, and I'm not surprised. How long do the filters last? On average, the filters last between 2 to 5 years. On average, we'll give it a 3-year average before replacement needs to be done. And we will manage that for you. We have filter safety specialists, as you can imagine, working with laboratories at the molecular level, they're changing their filters much more frequently. But in a commercial setting, such as many of you on this call, it's going to be about every 3 years. They will manage that, and they will provide you up-to-date status on when you should start looking at replacing the filters. There is a pre-filter before the first stage of HEPA filtration that would need to be replaced annually, just to ensure we capture any of the larger particles and we don't compromise the HEPA filters, the HEPA filter with larger types of particles. Another really good question here. I read an article published from the WHO, the World Health Organization, and it states that more than 90% of the world's children breathe toxic air every day. Can you talk about that? Yes, I can. I mentioned it at the beginning of the presentation. It's the fourth leading cause of death around the world, and it's just not third world countries. In 2016, there was published data that 600,000 children died from acute lower respiratory infections caused by polluted air. It is a big problem that we need to address. And again, as I mentioned earlier, this can no longer be ignored. If one good thing, if we can say that, the one good thing COVID did is I hope open the eyes to legislation and leaders and others to understand the impact of indoor air quality. And I hope that guidance and guidelines become established and standards are written in the very near future to address this. We're all concerned about the atmosphere. We're all concerned about the pollution we release to the atmosphere, but indoor air quality, it's just not addressed. Again, spend 90% of our time indoors. The air is 2 to 5 times dirtier than outside air because it's concentrated. There's other factors that play into that. Emissions coming off carpet, emissions coming off of flooring, radon, nitric oxide. There's all kinds of stuff going on. We need to address it. So yeah, I've definitely read that article, and it hits home for sure. Can you tell me how big of a space will a halo treat? Yes, it's a tailored approach. We really do a site assessment on all of our customers, whether we're there in person or we get facilities drawings. We'll work with our customers to ensure they have the proper amount of halos dependent upon their room sizes and the overall occupancy density. Typically, one halo for every 10,000 cubic feet will process 1 equivalent air change rate per hour. So that means once every hour, we're processing the air completely. But remember, it's continuous. So it's happening all the time. So we like to achieve between 1 and 3 air change rates per hour within all of our facilities. So again, it's a very tailored approach. Any other questions? Give a few minutes here. All good questions. And of course, if you have any other questions, you feel free, again, scan this QR code, you fill out the information, send us your questions, and we'll be happy to answer them for you. I'm happy to schedule another call if other people within your facility would like to join and hear about this technology, or if you'd just like to have a conversation. We're here to help support you in the process of developing the right strategies. So again, I thank you very much for being on the call. We appreciate your time. I know I went a little bit over my hour here, and we look forward to hearing from you all in the future. Thank you very much.